Did you know that there is a unifying driver to most chronic disease, most chronic conditions? There is a unifying driver to brain fog, fatigue, malaise, joint pain, autoimmune issues, hormonal issues, allergies, sleep dysfunction, sleep dysregulation. There's one unifying driver, and most physicians are not addressing it. In this next short video, we're going to talk about blood sugar. We're going to talk about insulin resistance and reactive hypoglycemia or hypoglycemia and how this is the generating force behind most of the chronic disease in modern society. What is blood sugar dysregulation? Blood sugar can be put into two different categories. On one end, we have blood sugar that's really high, and on the other end, we've got blood sugar that's too low. This higher category is going to have a continuum where we have insulin resistance or insulin insensitivity on one end and diabetes on the other. This other category where the blood sugar is too low, we've got something like a reactive hypoglycemia where it's not true, frank, pathological hypoglycemia, and then we also have true hypoglycemia. A lot of the cases, these two things overlap. Insulin resistance. Insulin resistance occurs when the receptors for insulin become desensitized. So what ends up happening is you're not able to shuttle glucose into the cell. We need insulin to bring glucose into the cell for either storage or energy. If it's not being shuttled in properly, things like non-alcoholic fatty liver disease can be a consequence. That's a consequence of inappropriately stored sugar. Oftentimes patients come to me and they say, I don't drink alcohol and I don't eat sugar. How do I have a fatty liver? This is how. Insulin resistance. Insulin resistance over time affects the whole system. We can compare that insulin resistance where the blood sugar is too high to something like reactive hypoglycemia or frank hypoglycemia. Hypoglycemia is defined as a fasting blood sugar that's at 65 or below. Reactive hypoglycemia is a patient whose body's physiology still demonstrates the hypoglycemia effects, but their blood sugar's not at 65, it's just a little bit higher. But that pathological process or that adaptation in physiology is still occurring. Oftentimes, these two things, insulin resistance and reactive or hypoglycemia, oftentimes these two things are occurring at the same patient at the same time. To get a true fix, what we have to do is first stabilize blood sugar and then bring it down. We can see signs of fatty liver by looking at the liver enzymes, AST, ALT. From an optimal standpoint, I want that to be the ALT, AST to be somewhere around 18 to 22. Signs of a fatty liver are going to be like the symptoms we talked about earlier as far as the brain fog, the fatigue. One of the ones that I hear often is a patient wakes up at 3 o'clock in the morning and can't get back to sleep. That's because the liver is unable to release sugar the way that it's supposed to. And so what ends up happening is cortisol is released at 3:30 as a surge, and that wakes the patient up. In the beginning of this process, the patient might be able to fall back asleep. If this continues, then the body starts to use epinephrine. That's when the patient wakes up and their heart is pounding, and now they can't go back to sleep. So it's just a little bit of a further along progression. So what do we do about this? What do we do about one of the most prevalent conditions that I see in natural medicine? We test. We get an accurate understanding of what's driving this process. This can be a low-grade infection, something like a cavity. Oftentimes, food sensitivities play into this. If a patient's eating food that they're sensitive to, whether they have an allergy or just a sensitivity, their body's going to respond to that by having swings in blood sugar. Sleep, diet, the way you eat, the time that you eat, all of these things matter. In general, I recommend when I first start working with a patient that they have a large breakfast, medium lunch, small dinner, 2 snacks in between. Their first meal should be consumed 30 to 60 minutes upon waking. Their last meal should be consumed about 3 or 4 hours before bed. When we go to bed slightly hungry, what ends up happening is we go through a process called autophagy. Autophagy is when your organs self-heal, self-regulate. And so if we go to bed slightly hungry, the liver goes through its autophagy, so does the brain, so do all the metabolically active organs, and they're able to heal and regenerate. By eating your first meal 30 to 60 minutes upon waking, we blunt the cortisol effect, we stabilize blood sugar, and then we keep it stabilized throughout the day by eating large breakfast, medium lunch, small dinner, 2 snacks in between, so that anytime the blood sugar starts to come down, we bring it back up and we sustain it. Again, when we're doing this process, the first thing we need to do is stabilize blood sugar, then we can drop it down. Let me guess what some of you are thinking right now. Hey doc, I'm not hungry first thing in the morning. I've never eaten first thing in the morning. Did you know that that is the most common question or response I get from a reactive hypoglycemic or somebody who has insulin resistance? That's the problem. So how do we fix that? We need to get digestion started. And so that can be something as simple as a protein shake. A good protein shake is going to include 1 or 2 handfuls of greens or some type of vegetable, like greens work well. I like arugula. It gives a little bit of a spicy flavor. I also use a riced frozen cauliflower. It's got a really good texture to it. In either regard, 2 servings of the vegetable. Vegetables work as a fiber, helps to stabilize blood sugar. Also helps to push stuff out of your digestive tract. We've got 2 servings of vegetable, 1 fruit. Fruit can be like an apple, a green banana, a pear, something that's got some substance to it, and then a handful or 2 handfuls of berries. Berries are really good for you because they will not spike your blood sugar. They offer polyphenols. Those are the molecules that you need to be able to feed the good gut bacteria. So a good protein shake is a great way to start digestion for somebody who's not used to eating a large breakfast. Over time, if the patient wants to move on to a complete meal, then they can do that. I myself, I usually eat a meat patty first thing in the morning. I'll have a meat patty, a couple sausage links, either some overnight oats with a ton of berries or just berries. What do I feel about caffeine? I like caffeine. That's how I got through graduate school. I graduated with honors because I drink caffeine. My preference is going to be green tea. Green tea sourced from Japan has been shown to be the most beneficial and least affected with things like lead or some other chemical. How do I feel about caffeine and patients who have coffee first thing in the morning? I'm absolutely fine with that if you can digest caffeine properly, or if you can digest coffee properly and you're not caffeine sensitive. It's interesting because a lot of practitioners in the healthcare field, when a patient wants to go on a detox or a patient wants to get healthy, the physician says, no more coffee for you. And I don't think that's right. Coffee can do some really good things. It can stimulate the gallbladder, it stimulates digestion. It can be really good for certain patients. If you respond well to coffee, I would say add in some collagen or some protein into your coffee, and that will act as your first meal. That is our first step into activating digestion and stabilizing blood sugar. One thing that helps patients through this process is a CGM. Really cool technology that wasn't available as much as it is now. Even up to maybe 5 years ago. CGMs work by giving us information real time, information as to how food is responding, how we're responding to the food that we're taking or the food that we're not ingesting. It also lets us know how stress affects our body. I've worked with patients who have high stressful jobs and they're eating perfectly, but their cortisol is going all over the place. And so once we have an appreciation for that, we can come up with a lifestyle strategy to help combat that. Or interventions like berberine or black cumin seed oil or things like that that are naturally shown to stabilize blood sugar. CGM stands for continuous glucose monitor. It's a device, a wearable, that's placed on the back of the arm, usually about 4 inches above the elbow. There's 2 companies that I like, Stelo and Lingo. My preference is Lingo. The way we use this device is if we start to feel tired, fatigued, anxious, jittery, any of the insulin sensitivity or reactive hypoglycemia type of symptoms, take a look at the monitor, take a look at your data and see what your blood sugar is doing. Typically what's happening is you're either rising up and cortisol is hitting your system or you're dropping down and you don't have enough glucose to feed your brain. So then we use that data to intervene with nutrition. Have a high protein meal. High protein, high fat meal. This will help to bring the blood sugar back up and stabilize blood sugar. Usually when I'm working with a patient with a CGM, I say, give me maybe a total of 2 CGMs. So about 4 weeks worth of data. The first 2 weeks gives me an understanding of how the food that you're eating is affecting you. And then the next 2 weeks is when we experiment by either manipulating the types of foods that you're eating or the timing that you're eating them or fine-tuning the way that you're eating them. Sometimes it's as simple as adding a tablespoon of olive oil to your rice or your quinoa. Sometimes it's as simple as eating your protein, then your fiber, then your carbohydrates. This is Lingo, and here's the deal. I sell these in office, but I make maybe $1 or $2. I do this because it's effective. I don't do this to make profit. I don't have any stock in this company. I like their software. I think Stelo has a better sensor because it's just a little bit more streamlined. This one's just a little bit bigger, but it still works. And the interface with their software is better. Lingo gives you more accurate information with regards to when the blood sugar is moving. And that's important so that if it's starting to drop, you can consume your meal. So the process is real simple. This is how it comes in its kit. We've got this little line right here, and we've got this little free space right there. You set that little line with the free space, and now it's lock and loaded, and then we just click, and it goes in. And then we wear this device for 2 weeks. I'd recommend sometimes using a little bit of athletic tape and covering the sensor, that way it doesn't bump into anything. Some technical considerations. I like fasting insulin to be at 85. That seems to be where most patients are optimal. Some other considerations when we're looking at blood serum is going to be hemoglobin A1C, fasting insulin, C-peptide. These are some of the things that I'm looking at when I'm looking at blood sugar. You can also look at electrolytes. Decreases in your electrolytes, your sodium, your potassium, your chloride, can show that your adrenal glands are releasing cortisol and not aldosterone. That's the hormone that pulls in your electrolytes. So if we see a decrease, a functional decrease in electrolytes, we know that your body is trying to stabilize blood sugar. Another equation that I like to use when I'm looking for blood sugar issues with patients is the HOMA-IR score. This is when we take fasting insulin and multiply that number by the fasting glucose and then divide it by 405. And your number should be below 1.9. At 1.9, that's when patients are starting to develop insulin insensitivity. And past that point is when we're going to start working with things like diabetes. In closing, some of the things that you can do to help stabilize your blood sugar are going to be a large breakfast, medium lunch, small dinner, 2 snacks in between, eating your first meal 30 to 60 minutes upon waking, your last meal 3 to 4 hours before you go to bed. Exercise helps to lower blood sugar spikes and also helps to resensitize insulin receptors. Sleep is so important. If I could package the effects of sleep and put it in a pill, oh my God, that would change the world. So exercise, sleep, meal timing, these are some basic things that you can implement and watch your blood sugar stabilize and your insulin receptors start to normalize. If you liked the information I shared with you, please click subscribe, comment in the comment section below. I do respond to those if I can, and consultations are free. Feel free to book a consultation and we can talk more in depth about how this is affecting you. We've got one category where they weren't busy the first time, fasting blood glucose.